Welcome to the deep dive. We sift through, well, stacks of research so you get the essential info.
Yeah.
Fast.
Yep.
Today, we're tackling a big one, St. John's wort.
Hmm.
You know, Hypericum perforatum, super popular herbal remedy, but also kind of controversial.
Oh, definitely. And that's really why we need this deep dive. St. John's wort, it's got this huge paradox, right? On one hand, it's this ancient remedy, and science actually backs up some of its uses, like for depression. But then the flip side is its chemistry is potent. Really potent.
Yeah.
Meaning it comes with some serious, potentially life-threatening drug safety risks. You just can't ignore them.
Okay, so that's our mission today. We're going to sort through the sources, give you a clear guide.
Exactly.
We need to figure out where the science says it actually helps, how reliable the quality is out there.
Which is a huge question.
And critically, lay out the safety stuff, especially how it messes with prescription meds. That part's non-negotiable.
Right, and just to picture it, the plant itself is pretty distinctive. Bright yellow flowers. And they have these tiny black dots on the petals. And get this, if you crush the flower buds, like really crush them, they release this deep red pigment, almost looks like blood.
Wow.
That's a chemical called hyperecin. And that one, plus another called hyperforin, well, they're the main characters in this whole story.
Okay, hypericin and hyperforin. Got it. So let's start at the beginning. Its history. This is a plant, a perennial herb, grows pretty much everywhere.
It's really hardy, yeah. And its medicinal history, it goes way back. We're talking classical antiquity. It's one of the oldest known medicines in the West.
Seriously, like ancient Greece and Rome?
Absolutely. The sources show it was used for centuries. It was even in some of those old cure-all mixtures, theriacs.
Huh.
Then fast forward to the Middle Ages, you've got famous figures like Paracelsus around 1525 recommending it.
For what specifically back then?
Well, for wounds, definitely. For pain, especially nerve pain, and most famously for what they used to call melancholy.
Ah, melancholy, depression. It's fascinating connecting that old use to what we think of it for now.
It really is.
So how does that traditional observation link up with the chemistry we know today? Those compounds you mentioned.
Yeah, that's the cool part, the aha moment. We now know those compounds, hypericin and hyperforin, are largely responsible for the mood effects.
So they just knew it worked somehow.
Pretty much. They just knew it helped people feel better. Now, we understand the mechanism. St. John's wort acts as a reuptake inhibitor.
Like prescription antidepressants.
Exactly like many of them. It affects serotonin, dopamine, and norepinephrine. Basically, it helps keep more of these mood-boosting chemicals active in the brain. So tradition really nailed it long before the science could explain why.
Okay, so those two main chemicals, hypericin, the red stuff, and hyperforin, they're the key. But if this plant just grows wild, how do manufacturers make sure you're getting the right amount in a pill? Quality control seems tricky.
Oh, it's a huge challenge. The concentration of these actives can vary wildly. Depends on the soil, the climate, when it was harvested, how it was processed.
So it's inconsistent.
It can be, yeah. That's why there are efforts to standardize it. You'll see commercial extracts, especially the ones regulated as actual medicines in parts of Europe, often aim for a specific standard, like 0.3% hypericin in content.
But if it's not standardized...
Then, honestly,
Yeah.
you, the consumer, you just don't know what dose you're actually getting. Could be potent, could be weak.
Right, which brings us straight to the main claim. Can it really treat depression? You said the data here isn't simple.
Not at all. It's full of nuance. This is where looking closely at the sources really matters.
Okay.
If you look at the big picture reviews, like the Cochrane reviews, they analyze lots of studies together. The general finding is pretty positive.
Positive how?
They conclude that SJW extracts are significantly better than a placebo. And often, they seem to work about as well as standard synthetic antidepressants.
As well as SSRIs, for example.
Often, yes, but here's the crucial part. For the short-term treatment of mild to moderately severe depression, not the really deep major stuff.
Like mild to moderate and short term.
Right. And another important point from those reviews, it tends to be better tolerated. Fewer side effects, generally speaking, than the synthetic drugs.
That sounds pretty good, but there's always a but, isn't there? You mentioned the results seem to differ depending on where the studies were done.
Exactly. Why did some of those big, well-known U.S. trials, like that Hypericum depression trial study group 1 back in 2002, find it didn't really work any better than a placebo for major depression?
Yeah, what's going on there?
That's the key distinction we need to grasp. The studies showing the really clear benefits, they were often smaller. They specifically focused on mild to moderate cases. And importantly, many were done in German-speaking countries.
Why does that matter?
Because in Germany, for instance, SJW is often regulated as a standardized medicine. It's prescribed by doctors, quality controlled, not just a supplement off the shelf.
Ah, I see. So the big U.S. trial looked at something different.
Yes, that 2002 trial specifically recruited patients with major depression, much more severe. And in that group, the SJW extract they used, Li-160, wasn't statistically better than the placebo. And it was clearly less effective than the standard SSRI they compared it to, sertraline.
Okay, so the takeaway is really about context. It seems pretty solid for the milder end of depression.
Generally, yes.
But if you're dealing with major depression, the evidence suggests sticking to regulated medical treatments.
That's the consensus, yeah. Don't rely on an herbal supplement for major depression.
Got it. Now, the mood stuff gets all the headlines, but you mentioned other uses, things that align with its traditional history.
Right, we shouldn't ignore those. The sources back up its use beyond just mood.
Like what? You mentioned topical use earlier.
Yeah, traditionally they'd infuse the flowering tops in oil, used it for miter cuts, scrapes, bruises.
Does it actually work for that?
Research suggests it does. The oil seems to have genuine anti-inflammatory properties, and it can help ease pain. So useful for stuff like sore muscles, maybe joint pain, even some nerve pain.
Interesting. What else?
There's also some evidence looking at women's health. A few studies suggest it might help with PMS symptoms.
Really?
Yeah, and possibly menopausal symptoms too, like hot flashes.
Yeah.
Sometimes it's combined with other herbs like black cohosh for that.
Hmm. And anything more futuristic?
Well, there's some intriguing lab work. In vitro studies, so early days, but they suggest some compounds in SJW, like flavonoids and that hyperforin again, have antioxidant effects.
Right.
They might protect brain cells. There's even some research suggesting hyperforin might help break up amyloid deposits, which are linked to Alzheimer's.
Wow. Okay, so potential there, but very early stage.
Very early. Needs a lot more research.
Yeah.
But it shows just how chemically active this plant is.
Which is great if you have a scrape, may be helpful for mild blues. But that same potent chemistry in an unregulated pill, that's where we hit the danger zone. Exactly. Let's pivot now to that huge issue, regulation, or maybe the lack of it.
Okay. In the U.S., you said it's a dietary supplement. What does that actually mean for someone buying a bottle? It means everything, practically speaking. It means the FDA, the Food and Drug Administration, does not approve it for safety or effectiveness before it goes on sale.
Unlike a prescription drug.
Totally different. The labels don't need FDA approval. They might not list everything accurately. The amount of the active ingredient, like hypericin or hyperforin, could be all over the place. Or it could have fillers, even contaminants.
So you're basically just trusting the manufacturer.
You really are.
Yeah.
And we know quality control varies enormously from brand to brand. It's a bit of a Wild West situation.
Okay, that definitely puts the responsibility on the consumer. What should people look out for? Any red flags?
Yeah, the sources are pretty clear on this. Be wary of anything shouting miracle cure or secret remedy. And those real-life stories or testimonials, they're anecdotes. They're not scientific proof.
So what should you look for if you decide to buy it?
Look for independent third-party certification on the label. Things like USP verified or maybe consumerlab.com approved quality.
What do those seals mean?
They mean an independent lab has tested that specific product. They verify that what's on the label is actually in the bottle and that it meets certain purity standards. It's not a guarantee of effectiveness, but it's some assurance of quality.
Okay, good tip. Now, before we dive into the really critical drug interactions, are there any general safety warnings for anyone thinking about taking SJW?
Yes, definitely. Even if you're not on other meds, first big one, don't use it if you're pregnant or breastfeeding.
Why not?
Because those active compounds, hypericin and hyperforin, they get into breast milk. And we just don't have enough research on the effects on a developing fetus or infant. It's not worth the risk.
Okay, what else?
You should talk to a doctor before giving it to kids, or if you're over 65. And this is crucial if you're having any kind of surgery scheduled.
Yeah.
You absolutely must stop taking St. John's wort at least 2 weeks beforehand.
2 weeks. Why?
Because it can seriously interfere with anesthesia. It can affect your heart rate and blood pressure during the procedure. It's a major safety risk surgery teams need to know about.
Okay, that's important. But now, the main event, right, the interactions. This is where SJW shifts from potentially helpful to potentially dangerous.
This is the absolute core message, the part that overshadows almost everything else. Its ability to dangerously interact with a huge range of prescription drugs.
Let's break down how it does that. What's the mechanism?
Okay, this is key to understanding the risk. St. John's wort acts as a powerful inducer of your body's main drug processing systems. Particularly the hyperforeign content seems to drive this.
Inducer. What does that mean in simple terms?
It means it basically tells your body to rev up, to work faster at breaking down and clearing out drugs.
Like it flips a switch to high speed.
Exactly. Two main systems get turbocharged. First, there's an enzyme system in your liver called cytochrome P450-3A4, or CYP3A4. It's like the liver's main cleanup crew for drugs, handles about half of all medications. SJW makes this crew work overtime.
Okay, CYP3A4 gets faster. What's the second system?
The second is P-glycoprotein, or PGP. Think of it like a bouncer pump at the door of your cells. It actively pushes drugs out of cells and helps remove them from your body. SJW makes this pump work harder too.
So faster liver breakdown and faster removal from cells. The drug doesn't stand a chance.
That's the danger. The result is the drug gets metabolized and cleared out way too quickly. Its concentration in your blood plummets.
Meaning it drops below the level needed to actually work.
Precisely. You get reduced blood levels, loss of therapeutic effect. Essentially, the medicine fails. And that failure can be catastrophic depending on the drug.
Okay, let's get specific. This isn't just theoretical. Give us the high-risk drug categories where SJW can cause the medicine to fail.
Right. This is critical. First, hormonal contraceptives, birth control pills.
Why happens?
SJW speeds up their breakdown. This can lead to breakthrough bleeding and, worse, contraceptive failure. Unintended pregnancy is a real risk.
Wow. Okay, what else?
Drugs that are absolutely essential after major procedures, like immunosuppressants. Think cyclosporin, tacrolimus, vital for preventing organ transplant rejection.
And SJW interferes.
Dangerously so. By lowering the blood levels of these drugs, SJW has been linked to documented cases of acute organ rejection. The consequences are immediate and potentially devastating.
That's terrifying. What about chronic diseases?
Big risk there too. HIV/AIDS medications, specifically protease inhibitors and NNRTIs. Low in their levels can lead to the virus multiplying again, loss of suppression, and the virus developing resistance to the drugs. That seriously limits future treatment options.
Okay. Any others in this failure category?
Yes. Anticoagulants, like warfarin. Blood thinners. SJW reduces their effect, making the blood less thin than it needs to be, increasing the risk of dangerous clots, stroke, or pulmonary embolism.
So heart meds, transplant meds, HIV meds, birth control. It's a huge range.
It is. And there are others too, like digoxin for heart failure, theophylline for asthma, even some pain meds like oxycodone, and certain statins like simvastatin and atorvastatin. Their levels can all be reduced.
It's genuinely alarming how one herb can undercut so many vital medications. Now, that's the risk of failure. What about the other side, making drugs too strong? The toxicity risk.
Right, that's the serotonin syndrome risk. This is a different mechanism, but just as dangerous.
How does that happen?
Serotonin syndrome is caused by having way too much serotonin activity in the brain. We already said SJW itself mildly boosts serotonin, right?
Yeah, acts like an antidepressant.
Exactly. So if you combine SJW with another drug that also increases serotonin, well, you can overload the system.
Like combining it with prescription antidepressants, SSRIs, and things.
Precisely. Combining SJW with SSRIs or older tricyclics or MAO inhibitors, it's a definite no-go. Also dangerous to combine with triptans, those common migraine medications.
What happens in serotonin syndrome? What are the symptoms?
It's a medical emergency. Symptoms can include a really rapid heart rate, super high blood pressure, severe dizziness, muscle twitching or rigidity, confusion, agitation, and a high fever. It can absolutely be life-threatening.
Okay, so let me make sure I've got this straight. SJW can make some critical drugs too weak by speeding up their removal.
Correct, like birth control, transplant drugs, HIV meds, warfarin.
But it can make other drugs, especially mood-related ones and migraine meds, too strong, leading to toxic effects like serotonin syndrome.
You've got it. It's incredibly unpredictable and interacts in potent ways on both ends of the spectrum. Weakening some, dangerously boosting others.
It really highlights that tension you mentioned at the start.
Exactly. We've got this plant used for centuries with real documented benefits for mild to moderate depression based on solid research.
Right.
But its powerful chemistry fundamentally messes with how our bodies handle dozens of essential medicines. The potential for harm is enormous.
So boiling it all down, what is the absolute must-follow #1 safety message for our listeners?
It's simple and it's non-negotiable. Always, always tell your healthcare provider if you are taking St. John's wort.
Any amount, any type.
Any amount, any formulation, capsules, teas, oils, whatever. Be specific about the dose, the brand if you know it, and how long you've been using it. Your doctor, your pharmacist, they need to know. They can't manage your other medications safely otherwise. Doesn't matter if it's for pain, depression, blood pressure, cholesterol, infections, transplants, they have to know about the
Mm.
SJW.
Okay? Absolutely. Critical message. And before we wrap up, you wanted to leave us with a provocative thought.
Yeah, something to mull over. We know SJW's effects, both good and bad, seem heavily tied to that hyperforeign compound, right?
Right, the inducer.
Well, chemical studies show that hyperforein is actually really unstable. It breaks down pretty quickly when it's exposed to heat, light, even just air.
So it doesn't last long.
It degrades. So think about this. If the main active ingredient driving its potent effects is that fragile, what does that instability really mean for the reliability and the consistency of the dose you're getting from a non-standardized bottle that might have been sitting on a warehouse or store shelf for, say, 6 months? That chemical variability is maybe the final hidden challenge in relying on this herb.